Welcome to the Health Savings Account presentation for Southern Bank shares. Here are the basics of a health savings account. A health savings account provides a tax-advantaged way to save for future medical expenses. An HSA is a component of a high-deductible health plan. You must be enrolled in a high-deductible health plan to have an HSA. An HSA is an account that you own for the purpose of paying medical expenses for yourself, your spouse, and your dependents. Why should you have an HSA? First, for the flexibility to shop around for healthcare services for your medical needs. Second, all the tax advantages that are available. Through your individual contributions to an HSA, they are tax deductible and they avoid FICA and income tax. Second, you get tax-free withdrawals for qualified medical expenses. And last, you have tax-free interest on your account. HSA funds stay with you no matter if you change jobs, retire. It's your account, you own the account. Money you don't use in an HSA rolls over from year to year. Saving for retirement. After age 65, HSA funds can be used for the purpose without penalty. Only income tax is assessed. And last, as we talked about above, the tax-free interest. You have self-directed investments that you can put your money into, and they will grow from year to year, and that will help you with your health care or your retirement. You might ask yourself, how much money can I contribute to my HSA account? Last year, you could put in $3,450 as a single employee and $6,900 as a family. In 2019, that amount is going to be $3,500 for individuals and $7,000 for family coverage. Also, if you're over the age of 55, you can put an additional $1,000 in as an employee, and if you have family coverage, you can put in $1,000. The great news that we have for you this year is that Southern Bank Shares is raising the amount they're contributing to your HSA to $1,500. What is the eligibility for a health savings account? By law, to be eligible for an HSA, you must be enrolled in a high deductible health plan. By law, you're not eligible for an HSA if you're enrolled in Medicare or you're covered by another health plan that is not a HDHP plan, can be claimed as a dependent on someone else's tax return, or you're enrolled in a general healthcare flexible spending account, or are covered by a non-HDHP such as TRICARE or TRICARE for Life, or covered by VA or IHS benefits. What are qualified medical expenses? They are things like dental treatments such as fillings, braces, extractions, hearing aids including batteries, prescription drugs, eye exams, eyeglasses, contact lenses, premiums for long-term care, and out-of-pocket expenses including co-insurance and co-payments, acupuncture, and etc. Here are the forms you're going to need when you file your taxes with the IRS. And these forms will be provided by UMB Bank. You're going to need Form 1099, Form 5498, and Form 8889.
Here is a breakdown of the base and buy-up plans. The top red section compares the annual premium totals for both the buy-up and HSA plan. You will notice there's a significant variance in these premiums. The yellow section looks at the tax savings available if you were to max out your health savings account. We used a 15% federal tax rate in this example. The blue section looks at the tax savings of the buy-up plan as a result of paying less tax due to higher premiums. The next section, we added and subtracted these items to determine the initial savings of the base plan before claims. We first took the annual premium savings and added in $1,500 for the Southern Bank Shares Employer HSA contribution benefit. Then we added in the HSA tax savings benefit, and lastly we backed out the buy-up premium tax savings to come up with the initial savings before any claim experience. You can see over a 10-year period the numbers really do add up. The bottom section, we calculated a rough break-even point. This is the amount of claims you would most likely have to incur to break even with the initial savings of the base plan. We took the initial base plan savings, added in the buy-up deductible, and when you compare this amount to the base plan maximum out of pocket, you will notice that it is highly unlikely that you will ever break even on any tier level. The buy-up plan may make sense in scenarios where someone is taking an expensive maintenance drug or someone who has frequent need to see a doctor for something like rehab. Let's look at a few examples. This is Bob. He's trying to decide between the base and buy-up plan. First, let's look at the base plan. Southern Bancshares is going to generously contribute $1,500 towards his HSA. We highly recommend Bob maxes out the remaining $2,000 so he can have $3,500 in his HSA account. If he does, he will receive a $793 tax break from the IRS. Now let's look at the buy-up plan. Bob's annual premium is going to cost him $2,037. The IRS is going to give him a tax break of $461. This creates $2,293 to the good for the base plan and $1,576 out of pocket for the buy-up plan before any claims experience. This creates a total savings initially of $3,868 for the base plan. Now let's look at a scenario. In this example, Bob has a healthy year. He goes for one routine exam, which is covered at 100% for both plans, and one urgent care visit. Under the base plan, Bob is going to have to pay that $500 all out of pocket. This will reduce Bob's HSA account to $3,000, and it will bring his overall balance for the year to $1,793, to the good. Under the buy-up plan, Bob would only have to pay $75 for that urgent care visit. However, since he already paid a substantial amount in premium, his total spend for the year would have been $1,651, creating a total savings of $3,444. You're probably asking, what if Bob has a really bad year with high claims? In this example, Bob has an emergency room visit and inpatient back surgery. Under the base plan, Bob starts out with $2,293 to the good. He has to pay for both the ER and back surgery visit 100% out of pocket. He uses his HSA account, which brings it down to zero, and pays the rest out of pocket. Overall, Bob pays $3,107 out of pocket for the year. Under the buy-up plan, Bob starts out with $1,576 out of pocket before claims. He is charged a $300 copay, and he reaches his $2,000 deductible for his surgery. For this year, Bob's out-of-pocket comes to $3,876, creating a total savings, even in a bad year, of $769 for the base plan. Now let's look at a family example. This is the Smith family. They are trying to choose between the base and buy-up plan for their family. First, let's look at the base plan. This is going to cost the Smiths $10,072 annually. Southern Bancshares is going to contribute $1,500 to their HSA account. We highly recommend that the Smiths max out their HSA account to take full advantage of the tax savings available. They would receive a $3,867 tax break from the IRS. Before any claim experience, the Smiths would be out of pocket $4,705. Now let's look at the buy-up plan. The Smiths would pay $22,290 in premium for the year. They would receive a $5,048 tax break, leaving them at $17,241 for the year. This creates a total savings initially before any claim experience of $12,536. Let's look at a low-cost scenario where they have few claims for the year. The Smiths only use their insurance for a routine exam, which is covered at 100% for both plans, and one urgent care visit. Under the base plan, the Smiths are going to have to pay $500 all out of pocket. This will reduce their HSA account to $6,500 and bring the overall out of pocket to $5,205. Under the buy-up plan, Bob would only pay a $75 copay for the urgent care visit. However, since he already paid a substantial amount in premium, his total spend for the year is going to be $17,316. The total savings after comparing both plans is $12,111. Now let's look at a scenario with high claim experience. In this example, the Smiths have an emergency room visit and inpatient back surgery. Under the base plan, the Smiths start out with $4,705 of out-of-pocket expenses. They must pay for both the ER visit and back surgery at 100% which zeroes out their health savings account. They are responsible for paying the remaining $3,200 after the $7,000 from their HSA account. Overall for the year, they are out of pocket $14,905. Under the buy-up plan, the Smiths start out with $17,241 out of pocket before claims. They are charged a $300 copay for the ER visit, and they reach their $2,000 deductible for his back surgery. For the year, the Smiths are out of pocket $19,541. So even in a bad year, the HSA plan still saves $4,636 in this example. Health savings accounts is a great investment vehicle. Make sure to fund your health savings account and protect yourself from large claims. You can even think about using the premium savings to help fund your account. We've already discussed the tax advantages, how HSA funds stay with you when you change jobs or retire, that the money you don't use rolls over year to year, and at age 65 you can use those funds for whatever you want. It really is a great benefit. We hope this presentation has been informative. Please feel free to reach out to us with any questions you may have. Have a great day.